I'm Josephine. I'm going to take care of you today. And what is your name again?
Liam.
Hi, Liam. Good morning. And ma'am, how are you related to Liam?
Oh, I'm his mom.
Hi, mom. How are you?
I'm good. How are you?
Hi. So, what are you here? How may I help you today?
We're just here for a well check.
Oh, okay, okay.
Yeah.
That's good. So, we have. How old are you, Liam?
10.
Oh, okay. So we have a 10-year-old male who came for a well child visit, and then we gotta ask some anything illnesses. Does he complain of anything? Sore throat, coughing?
No.
No. Okay. Any chest pain, Liam? No chest pain. Palpitations? You know, like if you feel like there's a fast heartbeat. Did you feel that at all? Okay, good. And then I'm gonna ask the mom if he's complete on vaccinations like flu.
Yes.
Yeah, so he has the flu, and usually it's every year. And then and I'm gonna ask mom if he had any meningococcal vaccine.
Yes.
Yeah, and then did he miss any vaccines at all?
No.
Okay. Like chicken pox, was he vaccinated?
Yes.
Chicken pox, hepatitis A and B. Okay. And we have to ask also HPV.
Yeah.
Okay. Was he also vaccinated on measles, mumps, rubella,
Yes.
and meningococcal? I already asked that. Polio vaccine, I'm sorry. And then tetanus, diphtheria.
Yeah.
Okay. And during your pregnancy, did you have any bleeding, any trauma?
No.
Did you have any high blood pressure?
No.
Any fever or infectious
No.
illness? Okay. Were you on any medications or you?
No.
I'm sorry, I have to ask something like were you drinking alcohol? I mean, I still have to ask.
No, it's
no
okay.
prejudice, we just have to ask.
That's fine.
Smoke
No.
or premature rupture of membranes, a bag of water. Okay.
No.
Good. And when he was delivered, do you remember how far were you along? Was
41
it
weeks and a half.
Oh, was it post-mature?
He
Not
just,
really. Was he born normal delivery?
C-section.
Oh, cesarean.
Yes.
Okay.
He was going to be a big boy. So
Oh, okay. Was it the long length of the labor?
He was 8. It was, no, labor was, it was a C-section, so it was like maybe an hour.
Oh, okay.
Yeah.
Okay, that's okay.
Yes.
Was he? If you could remember only, and I guess I have a chart here that you gave me in your chart that says the APGAR score of the kid was 899, which is normal. Does he have any breathing problems when he was delivered?
No.
Did they have to use an oxygen?
No.
Okay, so was he yellowish when he
No.
was born? Okay, or maybe later on was he yellowish?
No.
Okay. Any birth injuries? Any problem with breathing? Feeding with
Oh, no.
Liam? Okay. Did you stay longer in the hospital? Well, after you were, or was he? Did he stay longer in the hospital after the birth?
No.
Okay. And the birth weight you said was if you
8'11".
Okay, that's a big baby.
Yes.
Any problems during the growth? Was he late when he was starting to speak?
No.
No. Okay. Was he there's any problem with the toilet training?
No.
Okay. At this time, does he have any specific problem? Like, does he have any problems telling you that there's a problem in school? Any grades?
No, he'll come to me and say anything.
Okay. And during this time, is he more aware of his appearance as
Yes.
a little teen?
Yes.
Okay, that's normal. And then does he express himself? How does he express himself in his behavior, clothing, hairstyle? Is he okay? Is it
Yes, he's okay.
voice or body characteristics? I'm just asking. And then if there's anything, of course, you're welcome to, if you have any concerns about it, you can talk to a provider. And then does he have a lot of friends or does
Very
he like
popular.
more?
Yes.
Oh, that's nice. He's shaking his head. He's more quiet?
He's
More
quiet, yes, but very likable.
Oh, okay.
Yeah.
But he has to have, but you said he tells things like if he has something that's
Yeah,
bothering
something
him, which
bothers
is
him, he
good.
speaks up. Yeah.
Yeah, but it's good, Liam, to tell mom about anything, and mom is gonna surely help you, right?
Absolutely.
Right. And you have to take note if he has something like unexplainable injuries, lost or destroyed clothing, books, electronics, or jewelry, frequent headaches, stomach aches, sickness, or faking illness. Because sometimes, this is a problem in school, bullying and all that.
Okay.
Some kids you will never know. Some kids bully other kids, and the kids won't like to tell you.
Yeah.
And then you just realize that how come my kid is losing this and that,
Mm-hmm.
and he's having all these kinds of illness that it's not really, you don't really, it doesn't really appropriate. Meaning, he's not really having a headache, but it's like frequently he's complaining of headaches and all that, or he's faking illness that that he doesn't have anything, but he's always saying something like, I have a stomach ache or something like that. And then, does he try to appear like an adult? Which is sometimes good.
Sometimes, yes. Yeah, sometimes. It depends when it comes to like managing his money, what he wants to spend, what he doesn't want to spend, stuff like that.
Sometimes he needs to have a little independence, of course. And are you aware of child's whereabouts, activities?
Yes.
That's good. And does he defy you sometimes, which is normal, of course.
Oh,
but
sometimes.
Yeah. And are you well attached with your child?
Yes.
That's good. And then I'll ask Liam about some questions. Do you want me to ask you in front of mom? Okay, that's good. And then do you have any challenges today that like really big problems? Okay, that's good. And when you do, of course, you have to run to mom right away, right? Mom is gonna help you. And then, are you stressed out? Whether you're liked by others or classmates? Okay, that's good. You have your own identity, right? Do you usually, I know sometimes I did before, I defy also my elders, but do you usually defy your elders or teachers? No, I think you're a good
He's a good
student. Do you have any worries or fears? Any worries? Okay, that's good. But if you have, you have to run to mom right away, right? And then, was he bottle fed or
Both.
breast? Okay, that's good. And then, was there any problem when you're introducing some solid foods when he was a little kid?
No.
Okay, that's good. Was he picky with food?
Very picky.
Oh,
Very
okay. What
picky.
foods do you like? Do you like cake? I bought some cake.
What's your favorite food? Pasta.
Oh, okay. Any vegetables? More nutritious, of course.
Asparagus.
Okay. Broccoli? No?
No.
Not really. Okay.
He loves asparagus.
Fruits? You like fruits?
What kind?
Okay.
Oranges and strawberries.
Okay, that's good. Also, we like to emphasize the use of fluoride, which is, brushing at least twice a day. Sometimes it's better to brush it 3 times a day. We floss once a day, right, Liam? And then family. Does anybody in the family have heart problems, high blood pressure?
No.
Mom, dad on your side?
No.
And father's side? No?
No.
Okay. Any stroke, diabetes?
Dad has diabetes and grandma from dad's side.
Okay, and they're taking the medication?
Yeah, they take the medicine.
Okay. Any abnormal bleeding? No. Okay. Any allergies to medications, Liam? No?
No.
Food? Not allergic to latex maybe or dust?
No.
Okay. Any growth problems like congenital anomalies, mental retardation? We still have to ask that?
No.
Okay, good. And I know you live here and it's live safety.
Yes.
Yes. And you got 3 kids and they're all fine.
Yes.
And you're fine with that.
Yes.
Okay. And then I'm going to ask some questions like, did you have any recent weight loss or weight gain?
No.
Okay. Any bruising or bleeding? Do you easily bruise or bleed? Okay. Any headache? Any problems with the eyes? Conjunctivitis, okay. Any blurring of vision? Do you feel like it's hard for you to read sometimes from a little farther in school? Okay. Any ear infection or I already asked sore throat though. No sore throat.
No.
Do you easily catch cold? Cold?
No.
Okay. Does mom realize if you or notice you snore at night?
Yes.
Yes. Is it a lot?
Sometimes. Yeah. Not all the time.
Is it really,
It's
really loud?
low.
Because sometimes there's a problem with the tongue, maybe blocking the airway.
No.
Okay. And did you notice if he has some bluish discoloration, like easily, when he tires out, does he easily out of breath and becomes blue?
No.
Okay, good. And then you said there's no chest pain, no palpitations. Does he have pneumonia at one point?
No.
Okay. And I don't hear any wheezing or coughing, right? So if we have a child who has cough symptoms, we have to ask, but Liam doesn't have any, but just in case a child comes to us with a cough or colds, we have to ask, did it suddenly came up or was it gradual? How long has it been? Is it wet coughing, dry coughing, hacking, whooping? Was it worse at day or night? Any problems encountered while we're coughing while feeding and sleeping? Does it bother the child while sleeping or running? And Liam doesn't have shortness of breath, chest pain, or tightness or wheezing, choking episodes or aspiration,
No.
nasal congestion. Also, if there is a wheezing, we have to ask, was it sudden or gradual when it came up? Any other symptoms like cough? If there's a shortness of breath, is there any chest pain or tightness? Is it associated with upper respiratory infection? And then if there's an occasional out of breath, is it increased with exercise? And then does it occur with activity or rest? If there is a chest pain, we also have to ask, was it sudden or gradual when it came up? Does it occur on inspiration or expiration or both? Or does it occur on movement or rest? If there's a chest pain, we have to describe whether it's a sharp or dull pain, and then we have to ask the child to point to the area of pain, whether localized on one area or does it radiate to other areas. Do you have any sports? Yeah? What is it?
Basketball.
Oh, you like basketball. That's good. Did you have any trauma or injuries? Okay, that's good. Any shortness of breath while you're playing basketball? That's good. Any nasal congestion, like it's hard to breathe through the nose? Okay. Any frequent tonsils? Like you can hardly swallow because there's something blocking in there? Okay. And does he ever have a streptococcal infection, sore throat from streptococcus? Because there's a streptococcus which is not streptococcal. Sore throat that's not streptococcal, rather. And then the other one, streptococcus, is really worse than the other one.
No.
And then no history of asthma or something like burning sensation after eating. Okay. That's a gastroesophageal reflux, which is common in the ear. And then I still have to ask this, but I'm sure you don't. But hopefully you're not pressured by anybody to smoke or anything like that, right?
No.
Okay, good. And then drugs, you don't want to do that, right? Marijuana use, okay. Do you know when the year the home was built? Maybe it's new.
This was built in 2020.
Okay, and I know it's in suburbs, but it's kind of safe for any pollution or anything like that. It's well ventilated.
Yes.
I see well ventilation, and the windows are all.
Yeah.
It's enough
Yes.
Whole area. And then, anybody smokes at home?
No.
Okay. Oh, we have a pet at home, right?
We
Only
do
one,
have a
but
pet.
I'm sure the mom always keeps the surroundings clean.
Clean, yes. He's
And
up to
the
date
pet
with
is
all
always-
his shots. Yes.
Okay, very good. And carpets, I don't see any
No
carpets
carpets.
because carpets also have some problems.
Yes.
Downside is, dust
Mm-hmm.
makes the kid cough too.
Yeah.
I would if I had a carpet at home. That's why we don't have any. What else? Any fumes, any chemicals that might be unsafe for the kid
No.
and the other kids, of course. And then, you already asked that. Okay. Now there's no eczema, right? Nothing
No.
like itchy all the time. Oh, no. So now we have to proceed with the physical exam. I'll just make it faster.
Okay.
So we have to weigh Liam. I have a weighing scale here.
You want
Take it
shoes on
away.
or shoes off? Shoes on or off?
Shoes off.
Shoes off. Cool.
And then the weight. You can weigh. Now I'm weighing. Just to show them the weight. We have the weight, and it is 120.
You want to move it? It doesn't show.
And then it's
Just
okay. And then we're gonna. I'll just have to show that Liam is. And I know she's taller than this. I guess he's 5'1". He's as tall as me. Anyway, you can sit back. I can't believe we're the same height. Anyway, oops. 3 more minutes. Wow. Okay, I'll be fast now. So I have to. We have to plot the weight and height, and we go look at the percentile. And we do the temperature, and then the O2 sat. And then the O2 sat. Oh, I didn't show that. Temperature, I should have show it. Temperature, and the O2 sat, and the blood pressure. So checking the blood pressure. And then respiratory should be checked in an older child. We go by radial pulse, and we check it and count it in 1 minute. And then a blood pressure, as we see, we already did that. And then we gotta check Liam's lungs. Oh, first of all, we gotta check Liam's tonsils, because that will be also a part of the respiratory. So what we gotta do here is ask Liam to say ah. I want to get older. So I'm gonna ask Liam to say ah, and then we depress it, and then we check for the tonsils. Tonsils are normal in size. And then after that, we're gonna check for Liam, can we take off the shirt? Just to show?
You want to take it off or pull it up?
Just to take it off.
Take it off, please.
And then we gotta show Liam's. We just gotta check for.
It's good like this. Good. Oh.
Okay. Inspect Liam. We gotta check for any chest abnormality. Sorry. Let me check. Any pectus excavatum, there's none. And inspect anything, bluish discoloration. And then inspect, then palpate. I'm gonna palpate. I'm gonna put my hands on you. First, the hands are warm, so it tells me that it's a good perfusion. And then I'm gonna put my hands on top of the chest, okay? I'm gonna put this on and say, breathe in and out, in and out. It seems like the chests are symmetrical in extension. You're gonna, do you wanna turn around and look at mom? And then breathe in and out, breathe in and out. Good. And then I'm gonna percuss. It won't hurt, I promise. It's just percussion. So that's resonant on both, from top to bottom, bilateral. And then I'm gonna show the front. I'm gonna do the same thing, okay? I'm just gonna percuss again. Sorry. See, it's all resonant on both sides. And then, I'm gonna ask Liam to fly a little bit for a couple of seconds or minutes. Mom is gonna lay on that side just a couple of minutes to show. Okay. Just a couple of minutes. And then we're gonna check for jugular venous pulsation. So I'm not gonna touch it. I'm just gonna pull this a little bit up, just a little bit. Then we're gonna check for, hold on, the jugular. You gotta turn your face to the left side. So there's no prominence of jugular venous pulsation. It should be 45 degrees, but right now we're gonna check for the second intercostal space. This is the second intercostal space, and we don't see any prominence, but we could check for the height. So one ruler should be at the second intercostal, and then the highest pulsation, which is less than actually, let's do it this way. It's like less than 3 centimeters. Sorry, I'll do it again. It's actually less than 3 centimeters on the second intercostal space. And now I'm gonna check for the point of maximum impulse using the finger pads. We're gonna check downwards, and then I'm gonna, it doesn't show. Point of maximal impulse should be at the 5th intercostal space, left mid-clavicular line. And then we could check the auscultate using the bell and the diaphragm. So using the bell, you could check for the left or right upper external border for any murmurs. If it's regular rate and rhythm, for the left upper, third, and then the 5th. We also have to do it using the diaphragm on right upper sternal border, left upper, here on the 3rd, and then the 5th. And then we also have to check for the liver span or the liver edge. So you have to percuss the change in the resonance to dullness on the right, and then palpate It's about 2 centimeters below the right subcostal margin. And then we actually have to check further for the skin if the skin turgor is normal. We already checked the tonsils, the posterior pharyngeal wall, and then we did check for the jugular venous pressure, the pattern of breathing, which is normal, precordial activity. There's no presence of precordial bulge and other chest deformities. And we also have to check as I said, the regularity of the heart rate and rhythm. We checked for any heaves or presence of thrills. And 1 to 2 centimeter, we checked for the liver edge. There is no tachypnea or respiratory distress. There's no hepatomegaly. And we checked actually at the apex for the 5th intercostal space, left mid-clavicular area. We checked for the first heart sound, second heart sound, any variation with respiration, any third or fourth heart sounds. There was no wheezing also on lung exam. There were no wheezing. On heart exam, there was no murmur, as I've said. There was no rales, wheezes, or rhonchi. And lastly, we have to check for abdominal aorta using the bell, and we check for any bruise. Also, we have to check by putting together you want to put your nails together like this. So that one, we gotta check for any diamond-shaped area in between the nails. That shows if there's a clubbing. But of course, Liam doesn't have any problems with coughing or anything like that for chronic cough, so he doesn't have any clubbing of the nails. And then, okay, thank you, Liam. You can sit. Now I'm gonna talk to Mom for a couple of minutes more. I'm gonna tell Mom, okay, Mom, Liam, for now we gotta do some hearing dipstick. And we're gonna check for hearing screen, you'll just to check up. Snelling testing. We could ask Liam to do visual acuity. We don't have the Snellen chart, so he could just check. You could just read that and then pretend that you're done reading. And then we could ask Mom, for now we could actually just check. I know it's normal heart assessment, but we could also do some X-ray and EKG. And then if there's any problems or findings, then we could refer to cardiology. So now our assessment is as we have a healthy 10-year-old child, and there's no indication for diabetes screening. It's just we did some CBC maybe to order. And between 9 to 11, we could ask for a lipid panel, and we can repeat at 18 to 21. We also can screen for depression. I know Liam doesn't have any, I'm sure, but we still have to make sure he's not, because he's quiet, maybe he's not aware that he's kind of having that kind of problem. And then we could follow up in a year. And then we have to check for the vaccines. I know he's already updated on flu, HPV, Tdap, or tetanus, meningococcal. And we have to discuss with Mom the pubertal issues, peer pressure. We have to advise. Mom will always have to observe. and that Liam will just have to not be pressured with friends or classmates. No bullying, though. As soon as you feel that you're being bullied, you gotta tell mom right away, and you have to communicate right away with mom. And also, good communication with teachers is a good prevention. Then use seat belts, helmets and safety gear, sunscreen, internet safety. Gotta tell mom, limit screen time, appropriate discipline for the age. I know Liam likes asparagus, so we have to be persistent and insist on getting the healthy meals. Exercise also, good dental hygiene, like I said, at least twice a day. And then, I don't think you have guns, but I still have to tell. Limit guns from the home or locking bullets or hazards of secondhand smoke is not good for the child. And advise a mom to involve him in a little decision making because he's already getting older. Allow a child a little more freedom as he gets older, and then taking them through with some issues. Get him involved in the things he enjoys. What usually do you enjoy? And opportunities to serve others. Assist him in handling arguments. Healthy alternatives to act out when you're feeling threatened or angry. Encourage to visit dentist at least twice a year and the eye specialist once a year. And compliment how child looks. Praise not just it, but praise the accomplishments. And then encourage mom to have a healthy weight, eat healthily. Mom to set an example. Provide child with low-fat or fat-free milk, yogurt, and cheese, so he could get an adequate calcium, good for the bones, right, and for growing up kids. Or at least of exercise. He's wearing protective gear, as I said. Limit the screen time, internet usage, not too much internet. Talk to the child's teacher if how you're doing in school. Tell mom to make it to school, back to school night, parent-teacher conferences, to be independent towards schoolwork. If he has trouble keeping track of time, help him out. Promote reading on a daily basis. Bond with the child. Observe for sadness, depression, nervousness, or hopelessness. Talk to the child about physical changes he's experiencing as he enters puberty. Have a safe and enjoyable activities. And get to know parents of child's peers. Keep track of the child and know what he's up to all times. Put alcohol away safely. Put medicines away in a secure location. Have a conversation with values, relationships, sexuality. See a trusted medical expert. And then discipline the child. Be firm and consistent. Insist that wear shoulder belts or safety belts when you're in a car. Give, as I said, the protective gear, sunscreen. Keep firearms locked away. I think that's it. Thank you so much.
You're welcome.